Hi, my name is Crystal, and I'm going to be your nurse today. Can you please tell me your name and your age?
I'm Susan overall, 15.
All right, Caesar. Today you are in for a head, face, neck, eyes, ears, throat, and nose evaluation and mouth evaluation. Do you have any questions?
No.
All right. Well, I'm going to hand sanitize my hands before we get started. And I'm going to start with palpating your cranium. And I'm feeling for any lumps, bumps, or any bruising, tenderness.
No.
All right. Next, I'm checking your scalp. And I'm just checking for any infestations, redness, irritations, any kind of bruising, any redness. No? Okay. Your scalp is nice and clear and clean. Your hair is brown, evenly distributed. All right, next I'm going to feel your temporal arteries. They are palpable, no thrills. Next, I'm gonna go over cranial nerve number 5, which is your trigeminal. All right, can you please open your mouth? Clench your teeth. All right, good. Next, I'm looking at your overall structure of your face. I'm checking the symmetry of it. And I see your eyebrows are nice and symmetrical. Your eyes are nice and symmetrical. Your nose, your mouth, and your ears. Okay, now I'm checking for your cranial. I'm gonna go over cranial nerve number 7, which is your facial nerve. And can you smile? Can you frown? Can you puff up your cheeks? Good. All right, cranial number 7 is intact. Okay, I'm gonna start off by palpating your frontal sinuses. Let me know if any tenderness.
No.
All right, your maxillary sinuses, any tenderness?
No.
All right, good. Okay, we're gonna start off with your eyes. I'm looking, can you please close your eyes? I'm looking at your external structure of your eyes, and they are your eyebrows and your eyelashes, your eyelids. I don't see any drainage, any redness. Can you please look up? All right, I am looking at your conjunctiva. They are nice and pink. I'm gonna grab the light. I'm looking at your sclera. They're nice and white. Your irises are nice and brown. All right, I'm gonna check your cornea. I have to check them from the side. All right, I see them nice and round. They are not concave. Can you please turn this way? All right, good. Okay, and now I want to check for your pupil reaction. Okay, let's see. All right, good. All right, next we're going to check cranial nerve number 2, and that is your optic nerve. Can you please read what this says?
Alcohol prepare.
All right, good. Cranial number 2 is intact. All right, next we're going to check cranial nerve number 3, 4, and 6. And this is your ocular motor, your trochlear, and your abducens. Okay, so just follow the flashlight with your eyes. Try not to move your head. All right, now look at the wall. Now at the light. All right, good. So cranial nerves number 3, 4, and 6 are intact. All right, next I'm going to move to your nose, and I am looking for overall the external structures, and I don't see any drainage or any redness. Can you please stick your head up? All right. I'm looking inside I'm looking at your nasal mucosa on both sides. Your nasal septum looks good in midline. Also, I want to check for patency. So can you please cover one of your nostrils? Deep breath. Can you do it on the other side? All right, good. That's good patency for you. All right, next we're gonna check. I need you to close your eyes. Next, we're gonna check cranial nerve number 1, which is your olfactory. Can you please tell me what you smell?
Alcohol.
All right, good. Cranial number 1 is intact. All right, next we're gonna move on to your ears. And I'm just looking overall. I see the outer structures. I don't see any redness, and both of them they are symmetrical. All right, please tell me if this hurts.
No.
All right, what about any part of your outer ear?
No.
All right, okay, let me do it on the other side. Does that hurt?
No.
Okay, what about any part of this?
No.
All right, good. Now I'm gonna check inside, make sure there's no drainage, no redness, clear. Can you turn, please? Okay. Checking the inside. All right, good and clear. Okay, now we're gonna check cranial nerve number 8, and that is your vestibular cochlear. And can you please cover one of your ears? And I'm gonna whisper something to you. Say it out loud.
January.
All right, the other one. March.
March.
All right, good. So cranial number 8 is intact. Next, I'm gonna move on to your lips. And when I'm looking at your lips, I'm just looking to make sure there is no irritation around your lips. It looks good and symmetrical. I don't see any sores. I don't see any kind of fever blisters. Okay, so can you please open up your mouth? All right, let's see. All right, big open. Okay, I am looking at your buccal mucosa. I'm looking at your teeth and your gums. Also, I'm looking at your tongue. I'm looking at your hard palate and your soft palate as well. Can you please stick out your tongue? I'm looking at your tongue. I'm looking at your tonsils. Go ahead and we'll check cranial nerve number 10, which is your vagus nerve. Say ah. All right, good. That's all intact. All right, now we're gonna cover cranial number 9, and that is your glossopharyngeal. Can you please swallow? All right, good. That cranial number 9 is intact. Next, we're gonna cover cranial number 12, which is your hypoglossal. Can you please stick out your tongue? Can you move it side to side? White tight dynamite.
White tight dynamite.
All right, good. Cranial nerve number 12 is intact. All right, next, we're gonna go, can you please lift up your neck? I'm gonna look at your neck. I'm just inspecting it. I'm looking and I don't see any lumps, bumps, or bruising. Your trachea is nice and midline in the middle of your neck. Okay. All right. Now I'm gonna go over your lymph nodes. Okay. As I palpate them, I'm gonna name them. Okay. All right. So first we're gonna start off with your preauricular, postauricular, gestogastric. All right, we're going posterior cervical, superficial cervical, anterior cervical, your occipital, your submandibular, and your submental. Can you please shrug your shoulders up? And this is your supraclavicular. All right, for the thyroid assessment, I'm gonna come around, and I'm gonna put my fingers up on the side of your neck. Can you turn? Swallow. All right, turn it on the other side.